Hi, I'm Dr. Ken Erickson, developer of the ProMaker method and creator of the Step Up to Ultimate Performance. I get questions all the time from patients and athletes, and some of them just boggle my mind that the answers aren't readily available out there in the general public. So I'm here to answer some of those questions for you. One of those questions is, do all runners get knee pain? And this one actually came up to me pretty recently. I was in having my annual physical with my own medical doctor, and I was telling him about my exercise routine, and when I happened to mention trail running, which is one of my passions, the first question out of his mouth after I said that was, how do your knees feel? And I just about wanted to explode, because there's this pervading assumption that anybody that runs is going to have knee problems at some time in their life. That's not true at all. And I want to make sure that you guys know that. Most times you'll find when you have a very highly repetitive activity, something like running, where you do the same activity over and over again, and you're using the exact same tissues, the same joints, the same muscles over and over, and you don't give yourself enough recovery time in between, your body will slowly develop the scar tissue that tends to interfere with the performance, interfere with the function of those body parts. And what you'll find is certain things will tend to get tighter while other things will tend to get weaker. With running, it's very common for the iliotibial band, the band that runs along the outside part of the leg, going from the hip down to the knee, to get tighter and tighter and tighter as a result of the shock that comes from the running, especially if you're doing a lot of uphill, downhill, trail type running like I like to do. So when you have that tightness of the IT band, it actually pulls the kneecap off center, it pulls it out to the side, and that makes it so that it starts to grind the joint underneath it, and over time it can actually start to wear away that cartilage. So it's a very, very common thing for runners to experience. However, it's actually not that difficult to treat. A lot of people will use a foam roller to stretch out the band, break up the scar tissue. I use a technique in the office called active release that does something very similar. And I'm going to show you through the Step Up performance method that you can actually do a lot of this stuff on yourself. So it is not something that has to happen to everybody, and I want you to know that so you can start to make sure that you maintain proper function of your body to prevent these kinds of things. So I want you to go out there, have a great time running, and we can deal with all these things on our own. So stick with us and we'll get you all through it.